good evening, good morning, good afternoon. We are here today to start a new session, and on behalf of the Global Indian Physicians COVID-19, we have with us Dr. Pratap Reddy, founder, chairman of Apollo Hospitals and founder of GAPIO. We have Dr. Mehta, founder, president of BAPIO, the British Association, and former president of GAPIO. We have Dr. Sudhir Parekh and Dr. Nandkumar Jairam from the executive committee of GAPIO. We have Dr. Anju from Australia, Dr. Sunil and Dr. Arun Garg representing Canada. We have Dr. Suresh Reddy, president of the American Association Physicians of Indian Origin, Dr. Sudhakar, who will become president, and Dr. Anupama, who will become president a year later. What we are seeing today is unprecedented. Life has come to a standstill. Some of us have read Love in the Time of Cholera by Nobel Prize-winning author Gabriel Garcia Marquez. Who would have thought that we will need to define the new normal in life in the time of COVID-19? Lives of doctors have really turned upside down. As we begin today's session, I'm going to invite Dr. Pratap Reddy, founder chairman of Apollo Hospitals and the founder president of the Global Association of Physicians of Indian Origin. Dr. Reddy is widely regarded as the architect of private healthcare in India. He has spent his entire life striving for excellence and bringing world-class healthcare into India, into the reach of millions, not just in India, but in this part of the world. He's been awarded the Padam Bhushan and the Padam Vibhushan. I'm going to invite Dr. Reddy to say a few words. Dr. Reddy, please.
Namaste. My wife and the entire healthcare community across the country and the world join me in giving our greetings to Sister Shivani. We are, as Anupam said, we are facing a healthcare crisis as we have never seen in our lifetime. The doctors, the entire health force is making every single thing to fight this virus, which today has become a pandemic. But it's the people who are under great panic. The various governments and the health force, private and the public health care, are doing their very best to win this war against this COVID virus. But the time we are still seeing across the world, almost every day, the increasing numbers of people who are infected and people who could not be saved. At this time, Sister Shivani, we know Brahmakumaris have done so much to bring peace and loving care for people across the world. I have personal experience, and even in my village, there are two Brahmakumaris who have made a significant impact on bringing peace and loving care amongst the community. We are so fortunate that Sister Shivani is here with us today to give us those caring, loving words which can calm our panic and bring the spirituality and love and caring attitude amongst all of us. Not just the healthcare people, and I think the entire people around the world who are now under tremendous panic will make a significant impact. And from all of us, we want to give you not our greetings, our pranams, and then look forward that this message will be carried to people across the world to bring them that peace and strength to fight this. We're so grateful to you, Sister Shivani.
Thank you so much, Dr. Reddy. I'm now going to invite our colleague from England, Dr. Ramesh Mehta. Dr. Ramesh Mehta is a distinguished pediatrician, founded the British Association of Physicians of Indian Origin, BAPIO. He also served as the third president of GAPIO. He has been honored with an OBE, Order of the British Empire, for his services to the National Health Services in the United Kingdom. I'm going to request Ramesh Bhai to introduce our speaker, Brahma Kumari, Sister Shivani ji. Over to you, Ramesh Bhai.
Thank you. Namaste, Sister Shivani. It's a great honor for us to have you with us. Thank you very much. Of course, the whole world knows you very well, but to complete the formalities, I will just very briefly give you an Brahma Kumari Sister Shivani is a gold medalist in electronics engineering. Ma'am, I'm really impressed that from electronic engineering to the Raj Yoga. Sister Shivani is practitioner of Raj Yoga meditation of the Brahma Kumaris. Her book, Happiness Unlimited, Awakening with Brahma Kumaris, elaborates on how and why we think and behave in certain ways and brought into limelight the perceptions and strong beliefs which influence our thoughts and feelings. Sister Shivani's television series, Awakening with Brahma Kumaris, has impacted lives across the globe, touching on values, self-management, inner power, harmony in relationship, law of karma, healing, self-improvement, and discipline and spirituality. With that brief introduction, Sister Shivaniji, welcome to Indian Doctors Field. Thank you.
Let's just take a minute of silence. Just a minute of silence. And together, let's create only 3 thoughts. 1 minute and 3 thoughts. And when we create 3 thoughts together, we're going to create a collective energy together here on the platform. The first thought will be, I am a powerful being. The second thought will be, my body is perfect and healthy. And the third thought will be, the world is safe and protected. Just let's create 3 thoughts. It's our little prayer that we will do together. But when we do it together with the same thoughts, it has a ripple effect which is going to radiate to all the countries from where we are. So just close your eyes for a minute and repeat these 3 thoughts inside. I am a powerful being. And feel the energy of this line. Because even when you just say this, it's radiating power to the world. I am a powerful being. My body is perfect and healthy. It's a message we are giving to our body. Each one on this planet is happy and healthy. Just visualize the world. Bring the globe in front of you and visualize those millions and millions and millions of people, each one happy and healthy. The world is safe. It's protected. Om Shanti. Dr. Sibyl has given us a very powerful essence of everything that's happening in the world. And each one of you are flooded with that information day in and day out for the last couple of months. Let's go to the world before COVID-19 and let's understand the dynamics with which we were living our lives. Most of us were living our lives, and we're not talking about doctors, it's just the world. Most of us were living our life believing that our mind is dependent on situations and people. And we could allow a simple situation like even a traffic jam to disturb our mind. We could allow a behavior from a family member or a colleague to create hurt inside. We could allow our mind to blame the situation and people and hold on to that pain for a very long time and say it's very difficult to forgive and forget. This was our life 2 months before this, which means we were living our life in which we believed that the mind is dependent on situations and people. And that is why society together had created emotions like stress, anxiety, fear, pain, hurt, and labeled it as normal because the world was not perfect for them. Their world was not perfect. And so not being perfect inside seemed so normal. And we were living that life. And then here comes a situation which has hit the world together. So it's not a personal situation, not a country situation, but a global situation. And now again, in this situation also, the crisis is outside. That's the truth. But here again, we have made our mind dependent on this situation. And we said when there is a crisis outside, it's normal to feel pain, anxiety, stress, hurt. And because we all said it together, now it was not 1, 10, 100,000 people saying it. Now it was the world saying it together. Fear is normal, anxiety is normal. Not for a day, but for a month or more than a month, 2 months. And so globally, we're creating a vibration of fear and anxiety. In a time when we want to heal people, in a time when we need high immunity system, in a time when we want our healers to have very high intuition power because they don't have enough medical evidence as to what method they are going to use. They have to use their intuition power with every individual patient. So in a time where we need intuition, we need healing energy, we together as a world have created fear and anxiety because we said, is the crisis outside means chaos inside. More than me, each one of you has enough evidence in your life of medical practice that state of mind affects bodies, and which means the energy that we are creating right now is an obstacle in our healing. Faith can heal people. Fear can slow down the healing process. You all have seen enough magic in your life where there were cases which medical science felt were difficult, but the powerful mind created miracles there. And there were cases which were simple, but their own troubled, stressed minds created complications with their body. So we have enough evidence that it's not a virus which is only of the body, the role of the mind in healing people. But how do we heal people when globally together we are creating fear and anxiety? So I personally feel we are sharing with everybody, but it's the healers which need to share it with the world, that if you want to heal people, if you want to finish this, if you want everyone to remain protected, then the one top responsibility of the world right now is to start creating calm here. If we have peaceful minds, calm minds, powerful minds, we will be radiating healing energy. When we do not have enough evidence of medicines and practices, then let's use the power of the mind to create the healing, because mind also is playing a role in the healing. But before we're able to radiate that message to everybody else, we as healers will first need to take care of our own minds. The need of the hour, first and foremost, is a change in vocabulary. Because of constant consumption of content from media and social media, and then of course you are seeing everything around you day in and day out, our vocabulary right now is not at the best vibration. So every word we are creating in our mind and every word we are speaking out is at a very low vibration globally. Tough times, challenging times, crisis, these are our normal vocabulary now. Every 2 sentences seems to have these words in the vocabulary. And when our constant vocabulary for a month or 2 months starts becoming low energy vocabulary, then it starts taking a toll on our energy field. which means the first thing, it starts taking a toll on the energy field of the healer. Just the vocabulary we are using. And then with that energy field, you have so many situations to take care of, new ways of healing, methods which are yet not clear. Like Dr. Sibyl said, you have to wear that gear, which is not the most comfortable one. You're not able to touch people, so you have to change your way. So much more to be done outside. So the more we have things to manage outside, we need a very high energy vibration here, and which will only happen if we first start changing our vocabulary, which means our every thought and our every spoken word. We all know the power of blessings. We all know the power of mantra. We all know the power of affirmations. So what is mantra? What is affirmation? What is blessings? They are high energy words. They are high energy words. So even when there was any situation in life, somebody would give us a mantra. They say, you chant this mantra. Oh, but I'm not well. They would say, okay, never mind. You chant this mantra is for health. So what did they ask us to do? They asked us to think and speak high energy words that would radiate healing energy. All of us right now are praying, are chanting, are meditating. We're all doing that in our own ways. But how much time are we able to do that? 10 minutes, 15 minutes, 20 minutes. Rest of the day, we are on the field. So our affirmations and chanting and mantra cannot be restricted to 15, 20 minutes. Our vocabulary now would need to be a vocabulary of affirmations, blessings, and mantra, which means high energy words, because it is our high energy words and thoughts which will become our protection. We first need to protect ourselves. Protect ourselves not just from the virus. That gear will protect us from the virus, but protect ourselves from the vibrations that we are surrounded by right now. Even those who are sitting at home, they're only able to protect themselves physically, but they're not able to protect themselves from the vibrations. So we need that high energy aura right now. We need to raise our energy field. If all of us together raise our energy field, first, we are emotionally protected. Second, we are mentally protected. Third, that has an impact on our body. And fourth, most important, your high energy vibrations have a direct impact on your nurses, on your junior doctors, and it has a direct impact on the patients, whether it is COVID patients or any other patient walking into the hospital. These are not the times where if you say to somebody, daro mat, sab theek ho jayega, don't worry, everything will be fine. Words are not healing people. Words are not able to change the state of mind of people. But if you are here calm, which means you're vibrating at a higher frequency, and the person that you are meeting is stressed and anxious, but if you're at a higher energy, then the lower energy doesn't flow up, but the higher energy flows towards the lower energy and pulls that person up. So if you really want to motivate your people, energize them, protect them, empower them, words are not needed right now, because words will not be able to do it, but our own energy field, which means our vibration. And our vibrations will create a soothing and calming effect on people. People will be in your energy space and they will get a feeling inside. It's difficult, but I'm sure everything is going to be okay. I'm 100% sure we're going to come out of this fine, because that's a vibration that they will catch, they will consume that vibration from your energy field. So this is a very important responsibility every healer will need to play. And of course, with all the patients who are coming in, can't expect them to be coming in with the most positive state of mind. Even if they're coming to a hospital for some other ailment, there's so much anxiety about going to a hospital right now. So we cannot give them an assurance and say, oh, don't worry, you're protected, you're sanitized. There's too much doubt and fear here. So we just need to raise our vibrations, then the vibrations of our team, then the vibrations of our hospital. People walking in, the higher vibration will influence them and they will start feeling better, before they actually start their treatment. So really it's the need of the hour to look at that aspect of life which we are ignoring completely because we are saying fear and anxiety is normal. Fear and anxiety is not normal. Fear and anxiety is a choice. It's a response that we are creating to the crisis outside. In the same crisis, different people create different responses. And it's not about COVID, it's always about life. Look at one situation which comes to a family of 4 people. One situation which comes to a family of 4 people. One family member will say, Kitni badi baat thi, which means it was such a big problem. Another one will say, Choti si baat thi. Yeah, it was a little issue. Third one will say, Kaun si baat thi? Ye to normal baat thi, which means that's okay. That's a part of life. 4 people in a family, same situation, respond differently to the situation depending on how they are creating their thoughts here, which means situations do not create our thoughts. Crisis does not create our fear. Our fear is our choice. And we have the power to choose something different. We have the power to shift from fear to faith. We have the power to shift from stress to calm. We have the power to shift from insecurity to confidence and certainty of everything being perfect very soon. What we think, we will create. What we create, we will radiate. And what we radiate will manifest. In Hindi, it's a very beautiful line. Sankalp se siddhi. Thoughts manifest. Sankalp se srishti. The world is created from our thoughts. Most of us have read the book Secret. We know about the law of attraction. Many of us have experimented with it, and many have seen the result of it, that thoughts manifest. Sankalp se siddhi hoti hai. Sankalp se srishti banti hai. If thoughts create my world, thoughts create my destiny and the destiny of the world, then what will happen when for 2 months, 3 months, the world together is creating low vibration thoughts? COVID will be a closed chapter after a few months. But the impact the fear and anxiety is creating on the minds of people might not finish off in a couple of months. And what is happening in their minds is also affecting their bodies. It's affecting their relationships. There has been a drastic rise in mental health issues in India, what I know of, in the last 1 month. 20% rise in depression and mental health cases in 1 month. High rise in domestic violence, child abuse in 1 month. This is a sign of weak emotional health. So let's start taking this mantra that Sankalp se siddhi, my thoughts manifest. Sankalp se srishti, my thoughts create my world. And just take charge that from today, I will not create those normal thoughts and words which the world believes is normal, because that's not normal. Crisis means I need to create better thoughts than what I was creating even before, higher energy thoughts. Now, to start creating high energy thoughts, what should I do on a daily basis? Simple. For some time, please do not consume information coming from media. We've heard and read and watched media quite a bit in the last 1 month. Like Dr. Sibyl just shared, the number of WhatsApp messages, and in every hour was some million, and half of them are related to COVID. If somebody keeps watching, reading, listening, it's the truth. It is the truth. But if I keep watching, reading, listening, content which gives me fear and anxiety, then it will be difficult to be calm over here. As healers, you only need information which is medical. But we do not need information about statistics, how much it's spreading, what happened in this country, which city has it reached. Not really. Because your responsibility as a healer is to keep your vibrations very high and take care of only those people who are in your region, your territory where you are there. By consuming information of the world, you're only lowering your vibration and not going to your hospital in the best of energy which is needed for healing. Even if we want to know what's happening in the world, it takes just 5 to 10 minutes, and that too written information. Print media, audio, and visual. All three have different impacts. So definitely not watching visual media, because that has deep impact here. Print media, 5 minutes, we will have all the information of what's happening in the world. But if repeated visuals, same words with a lot of emotion around it, not good for our energy field right now. Medical information, everything. But what's happening in the world otherwise, we don't need to consume, because right now our own protection is healing for a lot of people. So one is to protect ourselves from media, social media. Second is, even though you're going to be very busy nowadays, but still, it's a part of your healing. Please keep 30 minutes for yourself every morning. You're going into the world where the vibrations are low. It's like somebody going out to extinguish the fire. They can't walk into the fire like this. They have to protect themselves. Similarly, walking in to the disease, you're protecting yourself. But walking into a global vibration of fear and anxiety, you have to protect yourself. And for which 30 minutes every morning is always needed. But right now, it should be mandatory for each one of us that we begin our morning with 30 minutes only for the self, consuming very, very pure and positive content as the first thing in the morning, which means consuming content of peace, compassion, faith, security, miracles in the healthcare industry. We're just studying that. If we flood our mind with positivity for even 30 minutes in the morning, it will raise our aura, our energy field. Meditation for at least 15 minutes in the morning. Even for those who've never meditated before, this is the time we can do it. And if in the morning, we all pray, we all talk to God. But if you could just start experimenting with this, talk to God on a personal level. Talk about everything that's happening in your life right now. Tell God about every patient that is there in your hospital. Use that energy, invoke that energy to do the healing process with you. Surrender yourself to be His instrument and just say, I am your instrument. I'm not completely sure about what has to be done here. You use me throughout the day. Just invoke that highest power and allow Him to use you as an instrument. Like you use instruments, He will start using you. This is the time to use our spiritual powers. Where our power of science is not able to take care of everything, then let's start combining spiritual power with the power of science. So 30 to 40 minutes in the morning for us should be mandatory. First to study and then to meditate, silence our mind. When we will silence our mind and connect to God, talk about everything, share everything, this conscious layer of mind will start becoming silent. And when this inner noise becomes silent, intuition power will increase. And you will just get the answer, what you need to do with each one who is coming to you in the hospital, because each one may be needing a different kind of a treatment. Intuition power is what is needed to create our miracles right now. So that first 30 to 45 minutes in the morning, during the day, an absolute no to consumption of content from media and social media. During the day when you're in the hospital, after every hour or 2 hours, please take a break of 1 minute. Not just a physical break, but a break here to again sit back and consciously create high energy thoughts so that anything that's influenced you from the environment, you will clean it out after every 1 or 2 hours. Like you never forget to wash your hands, sanitize your hands, even otherwise and definitely right now. Similarly, we need to sanitize our mind so that we're not carrying infection of emotional vibrations from one scene to the other. We have to keep sanitizing our mind. So just take a break of a minute, just 60 seconds after every 1 or 2 hours. Stop, say your little prayer, say your little affirmation, charge yourself again, and go back into the next scene. Very important is the time before going to sleep. We need to be sleeping with very, very silent minds so that in the less number of hours that we are getting, our mind is getting energized and our body is getting charged. So we cannot sleep with stress and anxiety on the mind. So at least an hour before going to sleep, again, distancing from technology, and last 15 minutes, again studying something very, very pure and positive, so that the last words that go into the mind are very, very positive words, and those positive words will work on the mind and the body for the next 5-6 hours. 15 minutes before going to sleep. And before going to sleep, write out or speak it out to God, or whatever you feel right, whatever's on your mind, whatever's troubling you. Like some of us write letters, write a diary. It's a way of bringing out our emotions before we go to sleep. It's a way of silencing the mind before we go to sleep. Otherwise, if we just fall off to sleep, then it's only the body which sleeps. The mind is thinking too much. And if the mind continues to think at night, then we're going to wake up in the morning, but the mind will not be that vibrant, fresh, energetic self, because it slept with stress. And because it slept with stress, it has radiated that stress to the body in those hours. And that is why, as a society, we are very sleep deprived now. Not just in these 2 months, otherwise sleep deprived, because we sleep enough, but we don't sleep right, because we don't silence and declutter our mind before going to sleep. So very crucial times before we go to sleep and when we wake up. Those 2 times are very crucial. And then taking a pause every 1 or 2 hours for 1 minute to repeat our affirmation. We will write down some affirmations right now at the end of this session. Repeat those affirmations, repeat your prayer, keep charging this battery of the mind to be at a higher level. At this time, the diet which we take physically, the food that we eat, is very important in terms of its vibrations, and also very important even for the patients. Food is not just the nutrients, but food is vibrations of the food. We've all heard the line, you are what you eat. Jaisa an, vaisa man, jaisa pani, vaisi vani, which means as is the food, so is the mind, as is the water, so are the words. Right now, because of the global vibration, the water of our city, the water of our country, the fruits, the vegetables, the grocery, everything that's coming into the house is carrying an energy of fear and anxiety. We cannot consume it as it is. It's not going to be safe for us. This is definitely not the time to have a non-vegetarian diet, because a non-vegetarian diet already has vibrations of fear and anxiety, just because those were the emotions of the animal before. So that fear, anxiety, aggression, stress, violence, and death cannot be the vibration of our food right now, because jaisa an, vaisa man. We cannot afford to consume any more fear and anxiety. So sattvic food, vegetarian food, home cooked food, and most important, cooked in a very high vibration state. Let us start having prasad cooked right now in our homes and in our hospitals. Prasad means the kitchen where the food is being cooked should have very high energy words playing in the kitchen. What is the difference between food cooked in temples and gurdwaras and food cooked at home? So in the temple, in the gurdwara, while the prasad is being cooked, there is mantra, there is bhajan, there is kirtan, there is jap, there is chanting while the prasad is being cooked. So the food gets energized with those words. We can do the same in the kitchen of the house, and very important, kitchen of the hospital. So when that is playing in the kitchen throughout the day, then the water, the milk, the tea, the fruits, the vegetables, everybody will become like prasad and amrit. And when we start giving prasad and amrit to everybody, it will have a very soothing effect on their minds. And just before eating, this is very, very important for all of us, especially because often you are eating in the hospital environment. Just before eating, please take a break of 10 seconds. We were all taught to pray before we eat. If we've not done it before, we need to do it right now. Just take a break of 10 seconds, pause, pray with the food, and say your affirmation to the food. And that affirmation will then become your natural state of mind. So just the morning, just before going to sleep, pause every hour, 1 minute, sattvic food, cooked like prasad and amrit, and a pause of 10 seconds before we start having our meal or a glass of water. If we do it so many times, food, drinking water, morning and night, then we will be repeating our affirmation about 10 to 15 times in a day. And that's enough to have a high energy thoughts and vocabulary. So at the end of this, after the Q&A, we'll just say those few affirmations again, and then you can start taking that up on a daily basis. Thank you so much. Om Shanti.
Om Shanti. Thank you, Sister Ji. While we will have all our esteemed participants think about asking questions, I just want to read out a couple of comments that came out. Ishant Wadwar said, think, create, radiate, and manifest. So I'll repeat that for everyone's benefit. Think, create, radiate, and manifest. And Manish Singhal repeated what he had said, Sankalp se Siddhi, Sankalp se Shrishti. And these are really powerful messages. Once Sister Shivani was asked about being calm, kind, and happy. And this was her reply. I think this question came up in one of her sessions in Manchester. And I quote, if I am one, the other two automatically happen. Calm is who I am. Kindness is my nature. And if I am calm and happy, then I will definitely receive blessings. And when I make it my aim to receive blessings at work, at home, in my relationships, then being happy becomes a way of being. Suresh, my colleague from the US, would you want to start asking some questions, Suresh?
Yeah, thank you, Shivani. Shivani.
Could you be a bit louder, Suresh?
Can you
Be a
hear
bit
me?
louder. A bit louder. Please go ahead.
1 second. Can you hear me now?
Much better.
Okay. Thank you, Om Shanti, Shivani Didi. And I had the opportunity to meet you in Atlantic City in person. And our president then was Dr. Ajay Loda. Unfortunately, he is in very critical condition right now in the hospital after treating several sick COVID-related patients.
Sorry, Suresh, there is an echo. If you could just keep the mic away. Sorry, you're making a very important comment. If you could just take your mic away, please.
Can you hear now?
Yeah,
Is it
perfect. Perfect.
Okay. Thank you, Shivani Didi, and thank you for joining us. These times I'm trying to stay away from the negative words after listening to you. And I had the opportunity to meet you in person in Atlantic City 2 years ago when our beloved president, Dr. Ajay Loda, was the president. Unfortunately, he's in the hospital right now in a critical condition after treating several COVID-related patients, and many of his patients passed away. Also we have another officer, Dr. Anjana Samadar, who was the regional director then. She is also in the hospital in a critical situation, and there are several RP members who are at the front line or suffering presently or slowly recovering, and some are in the hospital. As you know, this COVID has hit hard on the United States, and as I said, I'm the Dr. Suresh Reddy, again, president of American Association of Physicians of Indian origin. And I have two other teammates from here, from my team, Dr. Sudhakar Jonalagada and Dr. Seema Arora in today. And this has hit the New York and New Jersey and several other states so hard, and so much suffering has been going on. And after listening to you, I have become so positive. again I am healthy, I am strong, the whole world is strong, whole world is healthy. I have followed some of your words in the past, and what I do is whenever I log into a computer or whenever you have to use a user ID and password, all my passwords are some of your words like I am strong, I am happy, the peace, love. So that's already brings like strong vibrations into me and starts my day on a good note. And and with all the prayers and all the entire world coming together, I'm extremely confident that we are going to beat this invisible virus, tiny little virus, and will prevail. So thank you so much. And Anupam, you want to go to the Q&A session
Yeah,
now?
I'm going to do that. Sister G, we have a question from Pavan Rana. And he said, can you please elaborate on Sankalp Se Siddhi? Because this is very powerful and Sankalp Se Srishti. So if you could please elaborate on that.
Sankalp se siddhi. Sankalp means thought. Siddhi means manifest. So any thought repeated, not just one thought, but any thought repeated often becomes a reality. Let's take a simple example. You come home after a long day, and if we create a thought, I'm tired, I'm exhausted, I'm fatigued. It's a sankalp that we create. It's a thought that we create. The vibrations radiate to the body, and we're not going to feel fresh, energetic. We are going to feel tired. And then it's not just our thought. The family also starts saying the same thought. Bahut thake hue hain, he's very tired, leave him alone. So there's suddenly an energy of tired, tired, tired everywhere around us. And that's how we will feel. If you just sit back and start creating higher energy words that time, and you say, I'm fresh, I'm vibrant, I'm energetic, I'm perfect, I can go for a walk right now, I can go out right now. Just say it repeatedly with conviction, with faith, and you will start feeling better. And if people around you will say, are you tired? And you say, no, I'm perfect. And they will also start using the same words for you. And very soon, collective energy for you will change and it will shift to blessings. And that is what will become a reality. So we need to be very careful right now what thoughts we are creating, because they are not individual, they are collective thoughts. And when we create collective thoughts, and if they are a higher energy thought, we can create miracles. Imagine if we all had to create one thought that this one little thing which has come onto this planet, it's gone, it's finished, it's over. Let's keep thinking that and saying that, taking care of everything, but thinking only that it's gone, it's over, rather than thinking and saying, oh, it's going to be here for 3 months, 6 months, 12 months, more than that. Let's not say it so much, because it's too much when so many people are saying it together. One is working on it, but one is blessing it with what reality you want to see. So Sankalp Se Siddhi means do not create a thought of what you see, because thoughts will create reality, but create a thought of the reality you want to see. And that's what is a blessing. A blessing means create a thought of the reality you want to see, think it, create it. It's a vibration, it radiates, and it manifests. So that's where it is prayers, that's what is affirmation. But the need of the hour is that we have to talk that language throughout the day, not just for 10, 15 minutes.
Thank you, Sister G. There's amazing number of reflections that have come from across the globe about the positive message that you've given. And some of the doctors have said that it's really hard in this atmosphere when there's so much negativity to find positivity. But then the only solution perhaps we have, as you said, is to think positive. The only way we're going to neutralize the negative is through positivity. And I have to say that we're very deeply moved by the loss of our physician friends. We've lost physicians in England, we've lost physicians in India, we've lost physicians in the United States, and the global collaborative is actually going to put together a video paying homage to those frontline doctors who have given the supreme sacrifice in this war against COVID. Dr. Arun Garg from British Columbia just made a comment about the East meeting West and integrative medicine as a solution, and he of course is a big advocate for sattvic food and he's of course doing some amazing work in Canada pertaining to that. So there have been a lot of comments about Jaisa Man, Vaisa Tan, Jaisa Pani, Vaisi Vani. So clearly, the message that you wanted to give out has had the kind of impact that we were hoping to have, and that is always the case, Sister G, when you address us.
It would also be nice, just one thought, wherever it's possible, to have high energy words playing even in the hospital environment. Very soft, not disturbing anybody, but that energy vibration, if we could create in the hospitals, like we've seen videos of doctors coming and doing Om chanting together, but they're doing it together, which is amazing, but they can do it only for 2 minutes, 5 minutes. But if you have something playing there in the background, that could be playing throughout the day. So we have to use these powers right now along with our power of science in our healing. So if we could just play even a simple thing like Om or anything which is comfortable with everybody, but very soft, just playing in the background, it's energizing the whole hospital environment. And that's having an effect on every mind and every body in that hospital.
And this is something that we can do, Sister G. So I think all of us are going to take back this message and we will quickly implement this. And thank you so much for that. Suresh, you wanted to ask a question?
Yeah. A question from the audience, especially for a newcomer, like who has never done meditation in the past. And there are several of those. And how do we inspire them to start meditation? And so how can we get them into the meditation fold?
Right now, because of they are not able to go and learn, and there's also lack of time. Right now, we won't even call it meditation. We will just create 6 to 7 affirmations right now. And I will also send Dr. Sybil those affirmations on a little card. And we will only repeat affirmations. So that's something which everybody can do. Even anybody who can talk can do it. So even a 3-year-old kid, we've done this with even children. So even children are able to do it. So we will take those affirmations. We will begin our morning with that affirmation. Then we will repeat it in our mind once or twice every 2-3 hours. We will sleep with that affirmation, which means that will be our last thought. And we will definitely say that affirmation when we begin to eat and with every glass of water. That is all that anybody has to do. 100%, I'm telling you, 100%, because I've just got so many people who have done it. If somebody does repetition of that affirmation, a high energy word, about 10 to 15 times in a day, they are going to create a shift here within 1 week. Within 1 week, they will start feeling different, because it's like a black circle on a paper. There's a black circle drawn on a paper. You have to draw 5 white circles on that so that the black circle disappears. So if I want to delete fear and anxiety, I have to create 5 times positive thoughts on that. The thought of fear will start finishing off, and that will raise our vibration. So we'll create those affirmations now, and everybody just needs to do it morning before going to sleep, food, water, tea, coffee, sattvic food, and anytime you think of it. 10-15 times, repeating only 20 seconds during the day, actually. That's all. That's all that's needed for now. And then when all this episode is over, then we'll learn meditation together at the center.
Thank you, Shivani Didi. I have another question. Several of our Indian physicians and several other physicians too are at the front line fighting this COVID disease, and they are seeing these patients die. And these patients are dying alone in the sense that there is no family, nobody is allowed nearby, and they know they are going to die and they have nobody nearby. So can you give us like a 15 to 30-second prayer we can pray as physicians for these patients who are dying lonely?
See, when the dying means the soul leaves the body. We know that. Now, what's going to happen in this case? The soul is leaving the body without having their family members around them. So that's not a very comfortable feeling. You know how everybody wants their whole family to be around them when they're leaving, they meet everybody, they say what they have to say. That is meaning the soul leaves with having settled everything with all their family members. But they're not able to do this right now. But then everybody around them here can be a family member. And also their family member. If the family members can be informed about something like this, even if you're not physically around a person, even from where they are at home, if they are able to radiate the right message, they will help the soul on that journey. It can be done from wherever we are. It's not necessary we have to be physically present. The family can do it from where they are. Pray whatever is their prayer for their family and for their religion, and also say to the soul whatever they want to say as a family member. That has to be something very personal, but they should do it from wherever they are. So they should at least be told about it, and they should be allowed to go through this process, not thinking, oh, I'm not with my family, but actually they should create a thought, and the family should create a thought, we are with you. You don't have to be standing next to somebody to be with a person. Create a thought, we are with you. And we tell the family and we tell the soul who's there, your family is with you here in your mind. Don't think that nobody is around you. It's all about how we perceive the same situation. So we should not say that they are alone and nobody's there with them. Everybody's there with them in their prayers and blessings. So the soul is going to move forward with a lot of blessings. That should be our priority.
Thank you, Shivani Didi. I have another question from my friend, Dr. Kusum Punjabi. She's a ER physician from New Jersey, and she's a staunch follower of you. And she's fighting COVID patients on a daily basis. And she has a question. Can you give us a 5 to 8 minute guided meditation before we can hear before sleep?
Yeah, I've already got it. So I will
Okay.
send it on WhatsApp right now
Wonderful.
to Dr. Sippal, and he'll circulate it.
And there's another question from the audience. How to have a body? I know you repeated, but this is you have already answered. But how to separate your body and mind at this time?
Body and mind are always separated. So it's not. A mind is the energy, body is physical. But what we need to remember is what I'm thinking here is radiating to my body. It was always radiating, but right now I'm creating too much turbulence, which is not good for my mind and for my body. I know that I am a mind. I'm radiating energy to the body. When we practice those affirmations, there will be a soothing effect here, and you will find the relaxing effect of it on your body. You will automatically experience that because the energy from here radiating to the body will change. So
Thank you.
mind is our thoughts. What we think is the mind, and it ripples effect to every cell of the body. So we will start feeling differently, even physically. We will feel less tired, because there's so much to do, and to do it in an energy which is a little, so you will feel less tired if you're thinking right and thinking less. And that's
Thank
why
you.
content consumption needs to be taken care of. Don't consume too much content. Healers should, in fact, not listen to the news at all. Not at all.
Thank you, Shivani Didi. Over to you, Anupam.
Sister Ji, a beautiful, beautiful quote here from Narendra Khanna ji, and we keep talking about PPEs, and PPEs has been debated over and over again. So he's come up with the term SPE, spiritually protective emotions.
Yes, that's
So
what.
PPE and SPE together are going to help us fight this battle, spiritually positive emotions.
And also what's very important, Dr. Sibbal, as a healthcare industry, if we start radiating out more positive messages into society, it will be a part of the healing. If community starts getting more positive, you will have healing energy on the globe. So if the healthcare industry can radiate the same information, but motivating society, it will aid in the healing that is happening in the hospitals. So it's all connected. It's the air. We need to cleanse the air. So that's very important. So how we say it would need to probably change a little bit so that people start creating better thoughts.
And as we come to the end of this session, and we're going to wind up, so I just want to summarize some of the key teachings from Sister Shivani in just about a minute. You talked about neutralizing negativity with positivity, and as you always do, you give simple solutions. Starting the morning, spending 15 minutes meditating, getting positive thoughts, taking a break for just 1 minute, and there is nobody who cannot take a 1 minute break to pause. every time we eat or we drink, positivity, and then ending the day with positivity. And I think that's the recipe that you've given to us. And I think what you just said about decreasing the consumption, I think we are consuming the media, but I think the media is consuming us. And we really need to put, as life has come to a hold, to put media consumption on hold, because I think we're just spending way too much time with negative messaging, which really is not helping us. It's not helping us as individuals. It's not helping us as healers. It's not helping the community. It's not helping the nation. It's not helping the world. And I think we really need to bring that to a pause. We need to declutter our mind. I think we are cluttering it with a lot of thoughts about chaos and doom and gloom. And I think we need to declutter it and put in the positivity that you have suggested to us, and do that repeatedly. All you've suggested is 15 affirmations a day, 15 affirmations a day that each one of us can do, that can have such a positive impact. And if we do this collectively, and we do this repeatedly, and we do this day after day, we will perhaps have a huge impact globally. Sister Ji, just
High
wanted
energy
to,
words, high energy words in the hospital,
yes,
high energy words at home. Have something going on in the house also throughout the day. So that has a soothing effect on each one of us. So high energy words playing in the house, high energy words playing in the hospital, high energy words playing in your car while you're driving to the hospital. Just flood yourself with positivity. Overpower it. So it's not neutralizing the negativity, it's going to finish the negativity. That has to be our aim, because that's a part of the healing. So in your house also, everything, early morning, somebody has to switch on something so that it's high energy words chanting in the whole house. And then in the hospital, specifically in the kitchen, very important. We're going to cook prasad and give amrit to every family member and to every patient in the hospital, to the staff, to everybody, and taking care of our vocabulary. Vocabulary is very important. So the affirmation will eventually become our normal way of talking and thinking.
Anju Agarwal, our friend from Australia, said that, and you wanted, and in fact, you gave a different perspective, that let's not think about 3 months, 6 months, but we're all human. And on what she's asking is that, how will the world be when this all ends? We know it will end. We are sure it will. But how will the world be, Sister Ji?
How we want it to be, that's how the world will be. That's what it is. And that's why this period is very important. We all know this COVID will end. But if we raise our vibrations, shift our lifestyle, then that world which is going to be after COVID is actually going to be a very beautiful world, because we're going to come out wiser, not just intelligent, but wiser, prioritizing self-care, which was pending since very long, and we kept saying we didn't have time. We are going to come united. So there are a lot of things that are going to happen, but that's going to be a world if we want to create that kind of a world. And Dr. Sibyl, like you said, we are humans, so we are thinking like that, but we can't afford to think like that. We can't. We will have to say it's finished, it's over, it's gone, never to come again. Imagine if 800 crore people have to say it's over, it's finished, it's gone, never to come again. It's going to create a big effect. But if all of us are going to say, no, it's 6 months more, 3 months more, 1 year more, then we're literally escalating the issue just with our thought power. So let's use our thought power.
Suresh, you're going to share the question that Sudhir Bhai has from New York.
Yes. Shivani Didi, I understand you already answered, but can you, Dr. Sudhir Parak is one of my mentors. He's from New York, and he wants to ask one question, like, can you give us one liner, what we can say to the entire population to allay their fears, how to get rid of their fears. The whole world is under fear now. They are under extreme fear and scared. So if you can give it like a one liner, what we can repeatedly say the same thing to the entire population.
First just visualize it and come to your house. It's like if there's a crisis in the house and your children are panicking, what is that one line a parent says to the family? Just become that parent. Just become that parent. What's the one line the parent will say to the family? to bring everybody together with faith and say, okay, it's not as big as we thought. We're going to get out of this. What is the one line a leader says to their organization when there is a crisis? So that's how you are going to speak to community. But it will come only with conviction. The line cannot come from here. The line will have to come from here. So you feel it, think it, and then just start using that in your vocabulary. Ripple effect, that message will go from the healthcare industry to the world. The world will start feeling better. And when the world starts feeling better, you will see miracles happening in the hospital because you're going to invite beautiful energy there. And really the priority right now should be to create miracles in the healing. And that's why we need to use our intuition power. Please, please experiment with this. Anyone who's not done it, please do it. Please talk to God in the morning. Please talk to a higher power. Doesn't have to be any figure. Just talk to a higher power and surrender and say, I don't have the answer. Please use me to do what is right today in the hospital. Tell that higher power about all the 4, 5, 10 patients that are under your care. Tell everything and become an instrument. Go light and say, he's using me. And every day use a line for yourself. I am God's angel. I am God's angel. I'm not just a doctor. I am God's angel. He is treating his children. He is going to use me. Feel lighter and then radiate his power to people. Allow his power to go through you to people there in the hospital.
Sister, you mentioned here the power of positive messaging and positive messaging that a parent always gives to his or her children. Positive message that a leader gives to everyone in his team, and we have the privilege of having Mrs. Reddy and Dr. Reddy join us, and they've been with us since 6:45. And I just want to give this example because we all regard Dr. Reddy as the father figure, and he's treated all of us younger colleagues as his children. Is that he starts the day with positivity, he ends the day with positivity. From the time he enters the hospital, there's just positivity. Every message is positive, every comment is positive. There is just so much positivity that he brings, and he energizes. And I think we need to learn from someone as accomplished, as visionary as Dr. Reddy about positivity. Positivity is what is going to really help us at this point in time. Sister Ji, you mentioned that you will give us some affirmations. So as we draw this to an end, may I request you to share your affirmations with us, please?
And I'll also send it to you on the WhatsApp so that you can just share it with everybody else on the group. And if you could just email or send
yes,
it to them.
we will do that. We will do
so
that.
that it's there with everybody
Yes.
to revise
Yes.
it and repeat
Yes.
it again.
Yes.
Just sit back. Thank you so much. Just sit back and breathe in and out 3 times to just relax your body. We'll just say a few thoughts and just visualize those thoughts so that they're getting programmed on your subconscious. The power of affirmation and visualization to create a manifestation. I am the master of this body. I am a powerful being, untouched by the energies around me. I vibrate at the highest frequency. I am a pure being. My every thought is divine. My every word is a blessing. I am fearless and confident. My body is perfect and healthy and will always be. God's power and blessings is a circle of white light around me. Please draw this white light circle right now and draw it many, many times in the day. This is the most important affirmation needed right now. God's power and blessings is a circle of white light around me. This is my Suraksha Kavach. This is my protection shield. Nothing can enter into this circle. God's power and blessings reach every soul on the planet. Each one is calm and each one is healthy. Radiating God's power and blessings to each one who is in the hospital right now. Please see each one whom you know who is in the hospital right now and bless them. They are perfect and healthy. God's blessings is a circle of white light around the planet. The world is safe. This is a new beginning. That thing which had come into the world is over. It's gone. It's finished. Never ever to come again. I am God's instrument. I'm God's angel. He uses me to heal each one. I surrender completely to Him and allow Him to use me the right way. Om Shanti.